Emergency physician Dr. Trevor Jain, he's back for Talk with the Doc for March. Nice to see you.
Great to see you too, Louise.
We've got a good variety of questions to get to. So beginning with the medical school, of course, that has been in the news a lot lately. Someone wants to know what positive things you see in the future of PEI having a functional medical school.
So, as a frontline physician, I 100% support us having a medical school. We have a labor shortage nationally, and all provinces are under significant pressure to repatriate their own provincial seats. I mean, look, like PEI is the only one without a medical campus and without a medical school. In the next 3 years, there's going to be 20 medical schools and 41 medical campuses across the country. So, for the future of Islanders, my children, everybody else's family and community, we need to start training our own doctors.
So, and that was the point that the province has been making, that they need to, this is a solution for future. But what about now? What about the concerns about the effect on an overburdened system?
Yeah, no, I mean, that's an excellent question, but I would go back to people that are credentialed in medical education. Like, there's been lots of editorials and things on the media saying that it will decrease access to care for Islanders. And I don't necessarily agree with that. When I look at Tom Mary, who is the Deputy Minister of Health for Nova Scotia and a consultant at UPEI and happened to be my dean and a dean for many docs on the island, he said it's doable. When I look at Dr. Preston Smith, I mean, Dr. Smith is a recognized leader in medical education. He's a fellow of the Canadian College of Physician Executives with years of experience. He says it's doable. So, we have two outstanding medical education leaders, some that trained us, that say that it's doable. One of the things that they say is that maybe it'll decrease access of Islanders to care, but I don't believe that. We have a nursing school full of students. We have a paramedic school full of students. So by that argument, should we get rid of those schools? I mean, we need medical learners to look after us in the future. So I don't necessarily buy into that.
Okay. And you also teach as well as practice medicine.
That's right. Yeah, and I've been doing that since 2017 with no impact on my clinical duties.
On COVID.